outset, I'd like to thank AIOS for giving us this opportunity, and we have no financial interest in any of the apps. What is an app? An app is an application or a self-contained program or a piece of software designed to fulfill a particular purpose. You have to download it on your mobile, and there are various functions and contents for it, and today you have an app for almost everything. Apps in ophthalmology are for medical education, journals, conferences, patient use, OPD management, and apps for imaging. For medical education or for use of an ophthalmologist, you have a lot of apps, principal among which is the Eye Handbook. It has a lot of applications which can be used in our day-to-day practice, and this gives us many things which we can incorporate in our day-to-day testing also. So you have eye diagrams, media, patient education, testing, and vision symptoms. In testing, they have the Amsler grid, color vision chart, contrast sensitivity, duochrome test, fluorescent light. This is especially useful when you have a call in the ICU and you need to see a patient who's on the ventilator and you want to know whether there is any exposure keratitis occurring or not, or you can just put in a fluorescent stain and then use this light to check the cornea. And the near vision charts. So this is the contrast sensitivity. We usually don't do this in our routine testing, but then you can use it for your multifocal patients also. And it can be done very handily, especially if you have this app on your phone, or if you have a small tab which you can give to your patients for their testing. Worth 4 dot test, again very useful. So you can do the near worth 4 dot using this, and for the distance you can have the one which is there on your Snellens. Color vision chart, we all have our little black book, but we have seen that over a period of time the colors tend to fade. So in this, the colors remain the same, and you can use it for a very good fast screening for your fitness patients. There is pediatric optotypes are also available. So this is basically for kids. Kids, if you give them a smartphone, they are going to be very happy in your OPD. So you can just check them on your phone. There are fixation devices, and you can just check the vision also. Then there are calculators which are inbuilt in the app. So you have the age to bifocal amplitude of accommodation can be checked, the diopter to radius conversion. You have the glaucoma risk calculator, which is again a separate app which we'll be seeing. IOL calculators are there, and the IOP CCT calculator. This is also a very useful thing. Surgically induced astigmatism calculator is there, which is from the Warren Hill calculator. So you can calculate your astigmatism and design your incisions and work on your torics also. There are eye diagrams in the app, so you can just rapidly open up it and show it to your patients that this is the problem which you are having. These images were, I think, very popular on WhatsApp around 6 months back. They were being circulated a lot, and they were basically from this app, which shows all the symptoms which you can tell to the patient. Another one is ophthalmology, which gives you a very precise kind of information on your ocular disorders. So you can just scroll down the menu and see which part of the eye you want to check out for the disorders, and they'll give you a small treatment and a kind of Prezi kind of thing on the diseases. Draw MD, this again helps you in telling to your patient what kind of diseases is this. You have a specific template where you can take any disease, and then you can put in any notation or whatever you want, and you can share it with your patient so that they also know what is going on. iTube, as Dr. John has already gone through, you can have a lot of surgical options on this, and a lot of videos are there. So instead of searching on YouTube and having content which is not relevant to what you are searching for popping up in between, this is specifically eye related, so you can have a lot of videos in this. This is a very good app. It tells you the glaucoma risk. Again, it uses the OHTS guidelines. So you enter in your CD ratio, the CCT, and it will tell you the risk assessment and whether to treat or not. And again, this is with a disclaimer, it will be a guideline, not a this thing. This test was always one which we had lots of confusion, what's going on, what's not going on. So the Parks test on an app gives you a very rapid on-hand kind of thing which you can use in your diagnosis. Short forms are a nightmare in ophthalmology, and this app has all the short forms and their full forms in it, so that also can be used as a ready reckoner. Calculators and markers are, a lot of them are available in your app, so you can check the accuracy of your toric markings, positioning of your IOLs. You have the effective lens position calculator, so that also helps, and the LRI calculator, so you can add, just enter in your astigmatism and it will give you the incision size, site and all that kind of things. Simulators, like we have already seen, you have one for strabismus surgery also, and surgical videos and touch surgery apps are available, which you can use for your practice. Organizers are very important, and this helps in your day-to-day organizing. You can put in the notes, and you can just have in articles which you want to read at a later date, so you can, in case you scroll something, you can store it here. The surgical logbook also is a very useful app for PG, so you can enter all your surgeries and day-to-day activities here and keep a record. Again, this also helps in your day-to-day calculations. iGIFs for patient education, and so you can just show them the disease in the form of an animation which is easier to remember and easier to understand. I Know Tamil by Dr. John is again one useful app, especially for PGs. When you are posted in a region where you don't know the local language, you can just go through it and at least get the day-to-day relevant ophthalmic words. Apps for medical journals, you can have all your journals on your phone now, so that you can read it while you are traveling or something, like we all saw the Gurgaon traffic, and maybe go back home and do all this thing there also. So you have the IGO, the Will's Eye Manual, the Atlas of Ophthalmology, all of these are available. We have the apps for societies also online now, so that you can just go in and see. Apps related to conferences, like we have for our conferences also, so these help you for just checking through what the program is for the day, and it also gives you a short summary of what's going on and who is going to talk. Apps for patient utilization are very useful. You can tell your patients that you have to download this and this is going to help you in this manner. So there are low vision aids, special cameras attached, contrast sensitivity which will be different, so that they can be used for your ARMD patients specifically. Sidebook again allows you to do an AMSLR and put in the record of the patient's vision, so that the patient also knows what is going on with his eye. Game myopia is for your amblyopic patients, especially kids. If you tell them that you have to put in a patch and then do something, they will remove that patch. But if you tell them put in a patch and play a video game, they'll be very happy. So that helps. So this is the game myopia, and this has 3-4 games, letter hand, snake and all that, and it allows you to do adjust the contrast sensitivity and everything, and gives you specific instructions about what to do. So you can give it to your patient, and for your amblyopic patients this would be a very good thing. This is for the elderly patients who are living alone, who don't have anyone to help them with their eye drops. They would be having a smartphone. So download this app for them, tell them that you have to put in the list of medicines which you are using, put in a fixed time, and that alarm will go on at that time, and then they'll be able to put in the eye drops at the right time. Again, you have another one, the eye drop alarm. Be My Eyes, this is available for people who need help in navigation and in supermarkets and all that. So what this does, it sends out an help signal kind of thing, that a person is somewhere and needs help, and if anybody is available online, they'll come in, they'll see what kind of help is needed, and maybe read labels or something in the supermarket and help the person out. IQOS selfie, this allows the patient to take a selfie of the eye and send in you the picture. Then again, this comes with a big rider that whether to do WhatsApp consultations or not, but then this helps. Apps for imaging we have already seen. This is one thing before John made the adapter, so you can just roll up a cylinder. You have all these stiff papers available, so you can just do this and take a picture. Have your own app if you have a website. This is the age of digital marketing, so you have to have your presence on Facebook, social media and all that, so you can have your own app. and where patient can know about you and your team. Patient can have fix the appointments on it, give feedback, and stay in touch with the patient. If you have a patient who has to come for follow-up, you can send in an SMS to the patient through this, that this is the date where you have to come in and show to your doctor and get your pressures checked or whatever. Then practice management apps are also available, so you can have all your data onto this. Create your own app. This was made by my son and his cousin, and they wanted to do something. This was part of his school projects, where he did a vitamin A helper kind of thing. So screening of school kids for vitamin A deficiency. So you have all the information in this, where you just add into it on the app. There's a small questionnaire attached, so you can ask for general symptoms of the disease, maybe dryness of skin or a presence of any patch in the eye. And then you can just take a picture and upload it, and this goes directly to the WhatsApp of the surgeon who's there on the panel, and he can just see the image and then decide whether there is any problem or not. So you can, this app can be in the hands of any eye health worker, or the school teacher itself can do this, and so instead of the whole team going and spending time there, the teacher can just screen and send you the images, so that you can screen and provide the treatment also. There are certain issues with the apps. You have patient privacy issues, whether you have to have a consent before you take a photograph and send it around on the social media. Cell phones are notorious germ carriers, so when you take it in your OT, then bring it out in your OPD, and you have to know that you are carrying a potential source of infection. Like I said, social media issues are there. Authenticity of the apps which you are using, especially the one which you are using for the diagnosis and all. And maybe down the line, you'll, as we have seen, 1 or 2 apps now have the FDA approval, so that would be required. Thank you.